Al congresso europeo di dermatologia alle EADV di Parigi abbiamo incontrato il dottor Ralf von Kiedrowski, presidente dell'associazione tedesca dei dermatologi che svolgono un'attività libero professionale. Gli abbiamo chiesto di commentare i risultati dello studio di real life DELPHIN condotto con deucravacitinib in pazienti con psoriasi a placche che si presenta in aree difficili da trattare come le sedi genitali, palmoplantari, il cuoio capelluto.
Dr. von Kiedrowski, first of all, which type of study is this? Which were the patients you have studied and which were the objective of your trial?
The DELPHIN study was a non-interventional study we called phase 4 or phase 4, and is a study in the daily practice, about 18 centers across whole Germany, and it was a post-authorization study we called DELPHIN.
And the patient, which disease they had?
The patient has psoriasis, plaque psoriasis in the whole. We had about 653 patients in the study enrolled, but in this study we had a focus on the sensitive areas.
Which were the method of the trial? So it's a real-life trial?
It's a real-life trial, yes.
What you did exactly?
We did what we do in the daily practice. We analyze and we prescribe a TYK2 inhibitor, and we see what is forward for the psoriasis, but we mentioned the special areas with special scores.
And the drug was deucravacitinib at the usual dosage?
Yes, the clinical trial, not interventional, also we use original dose and prescribe as is authorized.
Let's go to the results. First of all, you have studied the impact on the nails.
Yes, we look in this study for the nails, for itch, and the sensitive areas. And the nails is a high problem. We had no topical treatment, which works very well. And so is a high improvement for the patient on the palms nail. And we had a target NAPSI, and we observe over, in this study, 52 weeks.
And regarding itch, with a very disturbing symptoms with a great impact on quality of life, which were the impact of the drug on itch?
On itch it was very good. We had an early improvement, and over the whole time we had about 75% who had a controlled itch or no itch.
And then you moved to the area so-called difficult to treat. Which were this area and which was the impact of the deucravacitinib?
The areas is the same we called upgrade criteria in the guidelines. It was the scalp, it is the palmoplantar, it is the genital and intertriginous.
And it worked also in this area?
It works very well, and it's also areas where we have no topical treatment, and so it is a very strong improvement. And over whole patients, we see early effects in the week 16, and in this study we look over 52 weeks, and we had about 50 to 75% improvement in all these areas.
This, as I said at the beginning, is the first real-life study for deucravacitinib, so it's very important. Which is the message that you take home looking at the results?
The message is a good work of this drug in the daily practice, and in special for the very difficult to treat areas in the scalp, in the palmoplantar, genital and intertriginous, and we have a high improvement early and over the time, about now 52 weeks by our patient.